All right. Well, we are so excited to welcome Dr. Christine Runyan to the ABIN webinar series this morning. Dr. Runyan is a clinical health psychologist, professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School and the co-founder of Tend Health. After starting her career as a psychologist in the Air Force, she focused her research, clinical service, and teaching on behavioral health science and family medicine, as well as promoting models of integrated primary care. Dr. Runyan is also a mindfulness teacher at the University of Massachusetts Center for Mindfulness. At the height of the pandemic, recognizing the undeniable need for expert mental health services for healthcare professionals, she launched Tend Health. Tend Health provides specialized, private, and accessible mental health care and education to healthcare professionals and consultation to healthcare organizations willing to invest in their most precious resource. Without further ado, we welcome Dr. Christine Runyan to the ABIN webinar series. Thank you, Dr. Runyan.
Yeah, thank you. Thank you, Kim. Thank you, Patty, for that warm introduction, and good morning to all of you. I do have some slides to share, but I thought we would just actually start kind of collectively by arriving. And so I'm gonna invite people to follow along with me as best you can, assuming you are not in transit. And I'd like you to start by just like actually opening your arms really wide, kind of palms open, as though you were just grabbing kind of the biggest beach ball you've ever seen. And this is just to kind of in our body, kind of make space for everything that's here for us, everything that individually, collectively we're holding. So wherever your mind has been this morning, whatever to-dos you've had. We had snow here in Massachusetts, so driving in the first snow, sort of on my mind and in my body a little bit. Whatever planning, thoughts, worries you might have about the day, about the near future or distant future. Maybe your mind is something that goes to the past, so we're just widening our arms, making space for all of it. And maybe even for some people, some things that are here that are more existential about the pandemic, our economic state, injustices in the world, climate change, I don't know, just make space for you to hold all of it. And then we're going to invite our minds and our bodies to just come into arriving, kind of where we are right now. So I want you to gradually just bring your arms closer and closer into the core of your body. So like you're kind of squishing out all the air of the beach ball. All those things aren't going away, but they're just taking up less and less and less space. And then eventually landing your hands on a part of your body that really feels kind of connected and grounded to you. So for me, that's kind of right at the base of my rib cage. You can feel my belly. And at this point, you may want to just cast a downward gaze or even close your eyes if that feels safe and comfortable where you are. And just allow your attention to rest on this breath. Wherever you are in your breath cycle, inhale, exhale, just grace your exquisite attention on one full cycle of breath. Breathing in, breathing out. So that all of this other stuff can be here, but that we can actually arrive right here where your feet are planted, where your body is breathing. Okay. And so with that, arriving right here collectively all together. We're not ignoring all the other mishigas of the mind, but we are coming into presence so we can be where we are. Okay. So I'm going to actually try, I think, to mute everybody just to minimize the background noise, but hopefully you guys can all see me. And I will start by saying that I really appreciate interaction through the course of my presentation. So you are welcome to unmute yourself. I think the chat is live and active. I hope so. People can say hi to one another. If you recognize a familiar name in the chat, you can engage with the whole group through the chat. That would be lovely. And I will have a couple points where I'm actually asking us specifically to do that. So I'm going to talk about what I think can sometimes feel like colliding emotions in clinical medicine. I don't know how many folks on here are clinicians and do some direct clinical service or not, and maybe that would be a great thing to just even start to put in the chat. Let me know if you could just say sort of your role, or if you're in clinical service. That will give me a sense of kind of who's here. But I'm going to talk about these what feel like sort of colliding or competing emotions of anger and compassion. And I'm going to talk about that in a way that I hope can get us a little bit closer to, instead of feeling like they're this, that we can actually hold them both skillfully. So a quick disclosure that I don't think is a conflict of interest. Sorry, my slides are getting away from me a little bit. Back here, but is a disclosure, is just like in the introduction, I am a co-founder of Tend Health, where we are passionate about providing highly specialized private mental health services and well-being services to healthcare professionals and healthcare organizations. So that's what we do. You can go to our website, check out what we have to offer, but I'm not here selling anything today. So here's a little bit of the map of where we're going. We're going to talk about the relationship between anger and compassion, what to do when anger enters clinical practice. And for those of you who may be more in an educational role and not direct clinical service, this is often a talk I will give to medical providers of different specialties. And so if you are in an educational role in that way, you are welcome to take some of these concepts and content and bring it into your educational space as well. Because hopefully we'll be getting to that point of how to manage the emotions that are real but have some complexity, and how do we manage those in the moment. So what do I mean when I say the dialectic of anger and compassion? So dialectics are things that seemingly are contradictory but exist at the same time. Right? And so there may be some irony in there may be some tension in there, but we have them in lots of ways, even in the work that we do. So some examples are, as clinicians, we use evidence-based medicine and we individualize treatment. We can hold both at the same time. We can be relationship-oriented, and we have to meet the realities, the regulatory, and I know there's some QI folks on here, the necessity of doing sort of paperwork and being responsive to insurance requirements in our organizations, right? As clinicians, we expect people to engage in self-care, and as clinicians, we don't always do the things that we might be advising somebody ourselves, right? These can be true at the same time. Those are some examples of dialectics. That on the patient side, patients don't want to be told what to do, and sometimes they can't figure out their own solutions, or they're asking an opinion that they might still butt up against, right? Patients wish they didn't have so many problems, and they may continue to use substances that only exacerbate their problems, right? It's not that they don't want to have these problems, or that they want to have them. They don't want them, and their behavior continues that pattern, right? We can see this all the time in patients and in ourselves. patients want to be treated like adults, and sometimes they don't behave as adult-like as might serve them well, right? So these things can be true at the same time. So I have a little bit of an, we can't do it as a poll just based on this format, but I'd love for people to chat in if you're willing. To just first acknowledge and see, like, how much have you felt angry with patients in the past 18 months or since the pandemic? And you could just maybe even chat in the letter, or you could chat in the response. Great. So a little but not often. Curious what's here for other people. Also a little bit but not often. Okay. For a lot of audience, when I've been doing this, I will say that, B, C, and D actually have been coming up quite a bit for people. Sometimes it's hard in this particular format, since we're chatting in, for anyone to really acknowledge because we don't have, we don't have the anonymity in using the chat as the poll to actually say quite a bit. So I will just own that I probably fall at B most times, but there have been moments where it falls into C for me. Okay. So even if you're not willing to chat it in, I encourage you to answer this for yourself. Now, how much have you felt angry with leadership in your organization in the past 18 months? This one I tend to get a lot of D's and E's. So I'll just name that people may not be feeling this towards patients, but they can definitely identify a sense of feeling angry towards leadership. Yeah, that feels very consistent with this group. Yep, a lot of C's and D's. Yep, I'm not seeing any E's, but to just acknowledge that that's here, that anger is here, and may have been here before the pandemic, but maybe not. So we're going to dive a little bit into this experience of anger and what this is all about. So I'm going to start here.
Here we go. All right, open.
This looks new.
Think it's safe?
What is it? Okay, caution. There is a dangerous smell, people. Hold on, what is that?
This is disgust. She basically keeps Riley from being poisoned, physically and socially.
That is not brightly colored or shaped like a dinosaur. Hold on, guys. It's broccoli! Well, I just saved our lives. Yeah, you're welcome.
Riley, if you don't eat your dinner, you're not going to get any dessert.
Wait, did he just say we couldn't have dessert?
That's anger. He cares very deeply about things being fair.
So that's how you want to play it, old man? No dessert? Oh, sure. We'll eat our dinner right after you eat this.
Riley, here comes an airplane.
Oh, airplane. We got an airplane, everybody.
Okay. So some of you might be very familiar with that movie Inside Out, that kind of looks at the role and function of all these different emotions through Riley. Yes, I love that movie too. And you can see in that anger showed up at the moment that there was this sense of something being unjust or unfair. Right. And that's when anger got involved. And so what is it about this emotion of anger that is here, but sometimes as clinicians, and as we've been trained as clinicians, and the expectation for being kind of infinitely empathetic and compassionate, where we just are expected to be this ATM of empathy, that it doesn't seem like there's much space for anger in our professional world. So what is it about this emotion of anger? So anger holds a lot of information, as you can see just sort of in that clip, that it's a valid emotion, and it often shows up when we're feeling powerless, or we're feeling a sense of protection for others. It is always a sign that our stress response is being activated, because it has a very physical experience. We can interpret anger or sense of anger from looking at people's posture, we'll have even the language we use around anger of sort of somebody's losing it, or, this idea of my blood boiling, right? That we have these phrases and language around this experience of anger that has a physiological component to it, that has something that is about how it shows up in our bodies. And it is often a secondary emotion. Now, what do I mean by that? So what comes out as anger, what we see as this sort of blood boiling, if you will, or this expression of anger, almost always has something underneath it that is being triggered to come up with emotion. So for example, I am not somebody prone to anger when I drive. If somebody cuts me off, or somebody, beeps at me because they don't like, how fast I'm going or how slow I'm going or whatever, or my general stance is like, I usually say it out loud. I'm like, oh, okay, that's what you need to do. Like, I don't tend to react at all. My youngest child is learning how to drive now. She's 16 and she has her permit. And so we drive with her a lot. And on the way to her school is a four-way stop that is a little bit mispositioned, so it's not this very clear, like, geometrically four-way stop, but it's clearly a four-way stop, and there's a sign that says stop always. And people seem to not be able to sort of figure this out. And so when she's at that stop, and this just happened recently, and she's going to make her left-hand turn, but the person coming towards us has essentially just stopped and gone, like did not appreciate that there's 3 other cars in the intersection. And my response is to get very activated and to, sort of raise my voice and to have all sorts of hand gestures, some of which may not be very appropriate or pleasant. And my inclination is like, no, stop the car. I want to get out and explain to this person how to do a 4-way stop properly, right? And that is just so different than how I would normally be in the nature of driving. But because it's my daughter, it comes from this place of protection. It comes from this place of, that's not right. And I feel this responsibility to protect somebody more vulnerable than me. So I will have this expression of anger that really is about fear and is about protection. So if you can think of the last time that you can recall being angry about someone or something, and really access that in the moment, right now. And then invite yourself to just look a little bit beneath the tip of the iceberg. And I would invite you now to see if you can access what other emotion might have been there. What else might have been showing up? And I would love for someone to unmute if you're willing to share that a little bit verbally, or to put it in the chat. That would be really helpful. Okay, sadness and hurt. Yeah. Disappointment. Also disappointment. Yeah. Fear. Fear is a very common one, just like in my example. Yeah, fear. Yeah. Oh, lack of control. Thank you, Crystal, for naming that sense of lack of control. When we feel powerless, anger can feel like some armor. If we feel any kind of vulnerability or lack of control, anger can feel like we're sort of pulling out the things that keep us safe and protected, or allow us to kind of fight a little bit. Yeah. So thank you all for engaging with this exercise just in the group, but also for yourself to begin to not dismiss the anger. Oh, good. Nice that people are sharing in there. So it's not about dismissing the anger, because the anger is a valid emotion and there's information there, but sometimes it's also about honoring what's underneath that is showing up as anger for ourselves. And what I think is happening a lot now, particularly in these last 18 months with the pandemic, of why anger feels so common, frequent, and for many people, it's just where you may not have had, be an angry person or feel anger often. And for a lot of people that I see now since the pandemic, it's like that's the go-to emotion. That's the go-to experience. Whereas 2 years ago, it was not. They may have allowed themselves to feel a little more kind of hurt or sad. But now the anger is really quick to anger. And here's what I think is going on that is contributing to that and has a lot to do with why anger is showing up right now a lot in clinical medicine and in work settings, and how to meet that in this dialectic with compassion, which we'll get to. So I just want to kind of remind people of the system that we have internally to us that is not related to anger specifically, although it does have a component of that, because when we have a stressor that's here, particularly anything that we perceive as potentially stressful, and if it's new, if it's unpredictable, and it's uncontrollable, right, we get a stress activation response. Well, what does that mean? Our sympathetic nervous system kicks off a series of events that is highly predictable and highly useful in situations where we really need to have we need to galvanize a very strong physiological response to meet that stress. We need our heart rate to be going more. We need our blood pressure to go up. We need our clotting factor to increase in case there's any sort of injury to our body. We need blood to go to our major muscle groups to not necessarily be spending any metabolic load on digesting our lunch, for example, or even on our ability to reproduce. We see this kind of temporary boost in immunity followed, if we have chronic stress, by a decrease in immunity. We have a lot of changes to our sensory perceptions and abilities in this time. So all of that response is happening beneath the skin, and it's happening pretty automatically with an acute stressor. And it prepares us to fight or flight, right? Our fight or flight system. And it's exquisite. We need that happening, and it serves us in a lot of ways. However, when that is happening for so long, when it's happening often, and when it's staying activated, right? So it's happening too frequently, the duration is too long, and it's happening too intensely for most of us, because most of us have not really settled back down to our homeostasis, our baseline. And so when that is happening, we have basically an overactive stress response that is creating what's called some allostatic load, which we're not going to get into today, but it's creating this strain on our system. And when we have any kind of stress response that's happening at a low level or at this heightened level, we go out of our window of tolerance, our optimal zone of arousal for us. Our optimal zone of physiological arousal is very connected into our emotional regulation as well, right? So when we are in optimal physiological arousal, like we have maybe a little bit of what's called stress, but not anxiety. We can have empathy. We feel safe. We feel safe externally. We feel safe psychologically in our own bodies. We can tolerate some perturbations of our emotions. We are curious about other people. We can have boundaries. All of these things happen in our window of tolerance. It is the place of deep connection and deep curiosity and deep creativity. When we are stressed, we are thrust outside of this window of tolerance into zones of hyperarousal, fight or flight, or for some people, hypoarousal. We sort of tuck in, protect, slow down. It's kind of our classic freeze response, if you will. And what I think is happening for many clinicians is that we are really in a heightened state of hyperarousal. And the signs that you are here aren't having to do with that really massive fight or flight response, but it has to do with that happening at a little lower of intensity, where you get a lot of defensiveness, you get really rigid in your thinking, and so you can't be flexible when things don't go as you want them to. You get a lot more impulsivity and anger and rage. And this is the place where, and I'd be curious for people's responses because I've heard this a lot, where people are just noting that they are snippy with their coworkers, maybe with patients. They really try hard not to do that with patients, but it takes a lot of effort. So they're more snippy with their coworkers and definitely more snippy at home, much more quick to be reactive at home. So I've heard a lot of that. I'd be really curious in the chat if other people are either noticing that in themselves or noticing that in others, of this emotional reactivity that I think is very much both a sign of and also a function of being out of this window of tolerance. That is our inherent stress response that has just been overtaxed during this pandemic. So that this intensity of anger is partly about the content of what's going on and partly about what's happening within ourselves. And I'll pause there to see if anybody, I'm not seeing anything in the chat, but certainly also if anybody wants to unmute and share from their own experience or what they may be noticing in others or in the settings that they're in, if they're seeing more of these things that are in this hyperarousal zone. Both hyper and hypo. Yeah. And that's very common. Oftentimes, if we've kind of been spending time in a hyper aroused state, our system basically goes into protective mode, right? And says, like, it really needs to tuck in. This is the place where people will say, like, I wanted to go to the gym when I got home, but I just came home and sat on the couch and I ended up watching 3 hours of Netflix, or doing something that feels like it just requires nothing of you, nothing from you. And so you're there kind of, but you're not really embodied. So this is not often a place where people will be reactive and angry, but it is an indication that your system is trying to kind of protect you by shutting down a little bit. And I've been seeing a lot of this, clinically, but not pathologically, I guess, is one of the messages that I have, is that this kind of experience makes perfect sense for the times that we've been in. This is not a function of, a clinical depression per se, or panic disorder or rage disorder. It is a function of unprecedented and out of control and novel stressors that are unmitigated on us as humans without any kind of control. So it's chronically thrusting us out of that window of tolerance. Yes, that the hyper pushes to hypo. Yeah, excellent. Yep. Yeah, beautiful, Wendy. So the constant outrage, and so you're kind of trying to incline yourself, and this is really where we're headed to actually be intentional about pulling out those other aspects, right? To see grace and compassion and gratitude. Yeah. So, when we're in these situations, like our nervous system actually needs some things in our environmental conditions to feel safe and regulated, to be in our window of tolerance. That's just, oh my goodness, sorry, my little clicker is pretty sensitive this morning. So to stay in our window of tolerance, our nervous system needs particular things from the environment. It needs safety, physical safety around us, psychological safety in terms of within our team, within our supervisor. It needs a sense of predictability, some agency and control that you feel like you can meet the demands upon you. It needs a sense of connection and belonging, and it needs recovery time. So I put this list out here because it is, for those of you who work in trauma-informed care in any way or work with patients who have experienced trauma, you recognize this list as these are elements that are essential for healing for trauma. So I just want you to reflect and think about your own environment. And this is not any indictment of anybody's specific environment, but I will sort of look at this in terms of medicine as a whole. That our healthcare system is not very good at creating this list of conditions for healthcare professionals, particularly any kind of recovery time. We go from one crisis or one situation that may be very hard cognitively or physically or emotionally, and we feel like we have to package it back up, compartmentalize it, stick it on the shelf because we have the next one to go to and 3 more people lined up after that. It's just the nature of the system. And so it's not an indictment of any particular healthcare organization. It is the nature of our healthcare system that is really poor at providing these elements to our nervous system. You enter a pandemic and all of these things get dialed up. And so on one hand, systems can sort of take some of this to be able to say, how can we gradually or slowly infiltrate some of these elements into our work day, week, month, into our system, but also just kind of acknowledging as individuals, if you can recognize that you're not in an environment that is very healthy in this way or can't provide that, what can you begin to do for yourself or within your teams to do more of that? Because what I know to be true is when our stress system is activated and we don't have these things available to us in our environment, and then we're interacting with other people who are also activated, that's when we are likely to stay in a hyper aroused state. Because an activated person can't regulate another activated person. We have to be able to create our own internal environments within our window of tolerance. When I'm in my window of tolerance, I can regulate somebody who's activated. But when we have really activated people, a nurse or front desk people or people interacting with highly activated consumers, you just get this dial up. And so that every day people are walking around in this really heightened state of activation. Again, I welcome any comments or feedback about any of that. It's really more of a recognition of current state of why anger is here and why kind of emotional reactivity. We are so primed for emotional reactivity right now because we don't inherently have these things within our healthcare systems. So I think we can probably all agree we have not all had the same pandemic. We have not all had access to the same information. We've had this nexus of shared experience, but beyond that, we've all had very, very different experiences. And as psychologists, if there's other psychologists in the group, you guys know that, we can have the same event, 10 people can experience the same event and have 10 different reactions. We have not had one event here in the pandemic. We have had as many different events as there are individuals. And so I make space in my own way of saying, like, why should we expect people to react all the same? Of course, people aren't going to be reacting all the same. it's not the same experience, and we don't all really have the same information depending on our sources of information. So of course we're all going to react differently. And when I can rest in that, it actually gives me access to a lot more compassion and a lot more ability to stay regulated, because I don't have the expectation that people should be reacting to things the way that I'm reacting to things, because we haven't all had the same experience. Now, that said, there are some things that make this particular event and the tale of this event very different for those of us in healthcare, because we have this sense of vulnerability for ourselves and for others. And particularly prior to the vaccine, many people who were healthcare workers in direct contact with people with COVID had a deep sense of vulnerability for themselves and for fear that they were going to infect other people, and going through all sorts of gymnastics to make sure that they were trying to be safe, including separating from family and loved ones. So that really is different. Notably, I've worked with many physicians who have gotten COVID, and sometimes the source of that is unknown, whether it's inside or outside of the hospital. Most of them are not angry about getting COVID. Now, true, most of them are also young and healthy and have not gotten so sick, but they're not necessarily angry about themselves getting COVID, but they are angry about the continuation of this in a way that feels very much out of their control. They don't have a choice, and many of you, this is probably true, about seeing somebody who is choosing, for example, not to be vaccinated. That is not within their control. They don't have that choice. And that's the part that can ignite some anger, not about them getting COVID themselves, but just that they are expected to show up with the same level of empathy and compassion, and they don't have any control or any choice. And some frustration I've heard about, people rejecting the same science that has led to the vaccines is the same science that sort of cures and heals people. So they want to take advantage of that, but not the science that sort of has led to the vaccine. I talked with a physician who was very angry with one of his patients, and let him know about that in probably a not particularly skillful way. His 3-year-old daughter had just been in remission from leukemia and had been undergoing treatments for leukemia for almost 2 years, and this father was unwilling to get vaccinated. And so that sense of like, this same science cured your daughter of cancer, and now you're unwilling to get vaccinated and maybe putting her at risk for something else, and express that anger very explicitly at the patient. And that sense that people are feeling towards people, those choosing not to get vaccinated, that I'm hearing a lot, is that, this isn't about you if you want to make this choice, but this is really about the public good and public health, and that it can, they sense that it's very selfish. And so those are the kinds of things that happen beneath the iceberg, right? Those are the kinds of experiences and personal emotions that people are feeling that bring them to a sense of anger. I had a patient, an internist, who this was last year, post Thanksgiving, caring for an elderly couple, both with COVID. And one of the husband, said to the wife, why did you make me go to Thanksgiving? And sadly died from COVID. The wife lived. And my patient, the internist, was sort of witnessing all of this and seeing them through the care, and was so angry, that, that this could have been preventable, was angry about, this preventable loss, but also preventable grief, was angry that she was experiencing this instead of, like, she made choices not to go to Thanksgiving to be with family, and then ultimately came back and said, I don't think I can be a doctor anymore. I don't think I can feel this way towards people. Was so angry with both of them that I should just not be a doctor anymore. And that has not been a rare sentiment that I've heard. I work pretty exclusively with physicians, and so people really doubting themselves because that feeling of anger feels so inconsistent with why they went into this work and what is expected of them. So I don't know if that resonates with anybody listening to this or on this call, but I just want you to also know kind of you are not alone in that experience, if so, and that some of this is both explicable from hopefully what I've been sharing so far, and it's not easy. There's a lot of distress there. And I think, related to why we see people leaving the profession in terms of nurses as well, because it feels like you don't quite know what to do with this large amount of anger and resentment that is so incompatible with being in a healing and helping profession. Because what we are trained to do, like to do, feel whole in doing is being compassionate, right? And so compassion is this sense of being aware of suffering in others and in oneself, seeing this as a part of the human experience, but also having this quality of like wanting to lean in and wanting to help relieve that sense of suffering through compassion. And the reason I think that compassion and anger really hold together is summarized very well from the poet David Whyte. And David Whyte writes about compassion in a way that I think, writes about anger in a way that I think really tips it on its head. He says, anger is the deepest form of compassion for one another, for the world, for the self, for a life, for the body, for a family, for all our ideals, all vulnerable and all possibly about to be hurt. Stripped of its physical imprisonment and violent reaction, anger is the purest form of care. The internal living flame of anger always illuminates what we belong to, what we wish to protect, and what we are willing to hazard ourselves for. Okay. What we name as anger on the surface is our outer response to our own internal powerlessness. And he goes on to say that anger is a quality to be followed to its source, to be prized, to be tended. It's an invitation, right? So that this idea that anger is really about our compassion. These are not separate; they're deeply connected. Anger, if you look beneath the iceberg, is always revealing something that we care deeply about. It's pointing to our values. It's pointing to the things that we wish so much to care about. An intensivist talked about a 32-year-old unvaccinated patient who died, and his mother was there. This was not during the peak when we couldn't have visitors. His mother was there and collapsed and was so overcome with grief. And this young man left children behind. And the intensivist saying that he felt such strong compassion and so much anger that this person did not and would not get the vaccine. Right? Of course, like to feel those at the same time, because it's that sense of it illuminates what we wish to protect the life of that man and for his children And so it's revealing, right? That anger is revealing that which we care so much about. So I hope that frame can be helpful for people, that the anger is really, right, it's putting up a flag to say, what's happening here? What is it that is being pointed to in terms of my values? Now, I do want to talk just briefly about ways of expressing anger that is here that can be skillful and not so skillful. So I think about constructive anger and destructive anger. Constructive anger is really going to, it's going to help you move towards like policies, procedures, ways of being that will continue to try to protect something you value. And it's going to, it is going to move in an advocacy and positive direction, compared to destructive anger, which is really used to kind of criticize, tear down. It can often be very personal, and it's an effort to try to control others. So when we use destructive anger, we are really, we're sort of squashing the conversation, or we might be maybe using some power to try to move away from it, rather than being constructive to move a little bit towards it. We know that we are in constructive anger expression when we can be assertive, when we can name what is upsetting, when we can be curious about other people's perspectives, and when we can get discussion to see alternative views. This is not a lot of what we're seeing kind of in the media or social media or anything related to even thinking about sort of vaccines or vaccine hesitancy, right? You don't see a lot of constructive expressions of anger where we can talk about what's upsetting, we can be curious about other perspectives. And so this is the invitation of like, it's not about dismissing anger or just like patting it on its head, like, oh, that's just compassion showing up as anger. But how do you be constructive so that you can actually move in a positive direction? Because you don't want to be like, the anger is valid, it's important, but can you do it in a way that is going to move you in a positive direction? So some tips about how to meet it. So I'm a big fan of just pausing, recognizing anger as it exists in you. Most of us have telltale signs about anger. Most of us will know a clenching of the fist, a tightening of the chest, a heat coming up through our chest, neck, and face. We all kind of have telltale signs. So know your signs. And if you can pause and use breathing or something else to bring you into your window of tolerance. Constructive anger expression always happens from our window of tolerance. Destructive anger expression happens when we're out of that window of tolerance, either hyper or hypo aroused. So you know that you have to be in that window of tolerance in order to be able to be constructive in your anger. And different things can get us back into that window, a little bit beyond the scope of this talk, but we can use different things. The breath is one of those that can always serve us to come back into the window of tolerance. And then with that pause, you can get curious about the source, right? You can see like, oh, what boundaries or values are being encroached upon here? What is being threatened? Is this about a sense of loss of control? This is about the naming piece. When we can name things, we can name both our inner experience and we can name how our outer experience is affecting our inner experience. There's a Chinese proverb that says, wisdom begins with the art of naming. Like, naming is so powerful to sort of get clear about it. And then we can see what those primary emotions are. Once we get to that source, we can see, is this about fear? Is this about not having any control? Right? It's from there that we can be constructive with our anger expression instead of being reactive and dysregulated. So anything that kind of can help with those regulation techniques, again, not that you don't address the things particularly if they're repeated things that are creating that emotion, but you do it from a place of being regulated and in your window of tolerance. And then compassion, right? Compassion, not just for the source, but compassion for ourselves. Compassion for, of course, you are feeling angry at the death of a 32-year-old man who's just left kids behind, who chose not to get vaccinated. Of course you are, that doesn't make you a bad clinician. It makes you a deeply caring, compassionate clinician. Of course you are feeling angry that this couple who had been, connected for 60 plus years, one of them is going home and one of them is not. Of course you feel angry about that and activated. And so this sense of compassion, not just for what's initiating the anger, but for oneself and what you're feeling, and not conflating that with anything about what it means for you as a clinician. And that could apply to, of course, you feel angry with some leadership for, whatever the things are. And can you have compassion that that's coming up for you because it probably is coming from some other source that has to do with how our nervous system is not being tended to in the environment. It's probably not about a particular leader. It's just about the system that can't provide what the nervous system needs at this time to be regulated. So having compassion for the self. And then a couple of other things, and I want to stop and then make some time for questions or comments, is that these are the other three things that I think have really helped me during this time in terms of meeting anger. What I think is sort of radical acceptance, which is never about condoning what is unacceptable in terms of being angry, but it's just an acknowledgement that some things just are. And I think the Serenity Prayer, I haven't found anything that sort of gets to radical acceptance better than the Serenity Prayer, which is, accepting the things you cannot change, the courage to change the can, and this discernment, right? This ability to discern what's in which category so that you can kind of drop the rock around things not in your control, and it gives you energy and agency to address those that are. Allowing some recovery time in grieving is really key to dialing down the anger. And then forgiveness. And I'll just leave you with that question. Who or what do you need to forgive? Including yourself. I've spent many nights early in the pandemic just going to bed saying, I just have to forgive myself for all the things left undone, of which there were many. And could I actively just work at forgiving myself for things left undone? Which really gets us to that point of, as a clinician, I never worry about clinicians' kindness for others in terms of being high. But I often worry that we don't step into that circle ourselves. We don't rest in that place of true compassion where we have kindness not only for others, but we have kindness for all the things that are being asked of us, how we're showing up, and how we're not showing up at times too. And that anger is not incompatible with being a really good and effective clinician. And sometimes it will propel us into being an even better version of that. But if we can do it from a constructive place and a place of deep compassion, so that those two things can really coexist. And I will stop my screen sharing there, and I will open it up to any comments or questions that people may have about anything that I've shared today. And you may have to unmute yourself because I think everybody is muted to do that. You can also put a comment or a question in the chat.
Sure. Thank you, Dr. Runyan. This is Kim Schuler. I just wanted to say thank you so much for sharing this for your own disclosure and for validating that for us as healthcare providers, for us as clinicians, this is a really difficult time. And I think that it's really normalizing that irritability and frustration and exhaustion and compassion fatigue, all of these things are happening. And I think that I'll just speak for myself. A lot of times I, especially in professional settings, am not really talking about a lot of the things that are happening, but it's what's the next task? Well, who's the patient in front of me next? What do we need to do? And so just pausing today and having an opportunity to do some self-reflection was very helpful. So thank you.
Thanks, Kim. Appreciate that. Yeah, I'm just noticing the chat too. Compassion-focused therapy in practice, that it helps with so many issues. Yeah. And that that anger is not, I think that sense of this, it can feel like they're colliding, right? Anger and compassion. And I actually think they are so inextricably linked. So yeah, thank you. Any other questions, reflections? Oh, thank you, Sai. Very kind. Thank you. Yeah, I do appreciate everyone sharing time. And I deeply appreciate, all the things that you all are doing, have been doing, and continue to do for your state, for your patients, for the system, and hopefully for yourselves too. Yeah, thank you.
Thank you so much for your time today. And also, as I'm reflecting on our learnings this morning, I'm thinking of the power of even a short mindfulness activity and how that helps recenter me and focus my attention and prepare me to listen. So thank you for that reminder as well.
Absolutely. It's just bringing us, again, into that window of tolerance, which we get thrust out of it so many times throughout our day, but we also have the power to be able to invite ourselves back in. Yeah, thanks.
It's 9 o'clock, so thank you all for your time today. We appreciate you joining us this morning and hope you have gained some skills to go forth this month and do some self-reflection and self-care. Thank you, Dr. Runyan.
Yeah, be well. Bye-bye.
Bye-bye.